This is my mother. She was a Peace Corps volunteer in Colombia in the 60s and went on after serving in Peace Corps to serve in another one of President Kennedy's signature programs, Head Start. She continued on as a teacher for the rest of her professional career and believed firmly in service. This is her on the back of a horse, riding from town to town. I was pretty much convinced growing up that my mom was Indiana Jones. She taught me so many lessons from her Peace Corps service. Just about every life lesson started off with, and I learned this in the Peace Corps, so I was like, okay, I get it. I get it. But one of the things that she taught me that really stuck with me was this idea of practical optimism, by which I mean that when you have a problem, if you can identify a clear, manageable part of that problem and make some practical decisions about how you will address it, you can achieve amazing things. In her service, she built a health clinic. And to do that, you need a lot of things. So when she needed a backhoe to, dig the foundation, she got on the phone with the governor. When she needed a doctor to staff this health facility, she called up the Ministry of Health. And there was no dogma about what could and could not be done. It was just practical optimism. This is her in 2012 at that health clinic that she helped build during her service. It's about 5 times as big, and it continues to serve her community. Now, I've talked a lot about my mother, but you can probably guess that by the fact that I'm up here and not her, that I've also done something in Peace Corps, which is true. I joined the Peace Corps in 2006, and unfortunately, I found something that wasn't exactly like that practical optimism that I had seen. I found some managing of expectations. I remember this moment very vividly because it's probably the most angry I've ever been in my life. Sitting as a trainee with a group of my fellow trainees, and one of the staff members made this statement. He said, "You're probably not going to accomplish anything in your service, so you should get a chair, put it outside of your hut, and read a good book." And I'm choking up just thinking about this because it made me so furious. And I was very happy to learn later on that this was the exception, not the rule, and that Peace Corps is filled with optimistic people. But I wondered, where did this idea come from? Where did this idea that we had to manage expectations come from? So I did a little research. I went out on the road and met with a lot of people who have been in foreign service for a number of years and talked to them and did my research. And what I came to realize is that, and this may be news to some of you, but in the 60s, they did not have the internet. And they didn't have a way of sharing information about what worked and didn't work in the facile way that we can do it now. And so it was fairly easy to go out into the field and do a project and leave your service feeling like you had accomplished amazing things and not worry about whether it continued on after you left. But over time, we've developed this corpus of knowledge about failure in the development field, and it affects morale. And it's not just knowledge in books, it's very visible to any volunteer who goes overseas. You'll see things like this, a hospital that has been half built. There's a computer tucked away in the corner of the door that you can't quite see, and goats out on the lawn. And so it's very visible what hasn't worked. You also have great ideas like this, which is a biogas digester. You put cow poo in, and what comes out is gas that you can use for cooking your food. And so, unbeknownst to me, what I had walked into when I joined my service was really a war for the soul of development. And it is between 2 ideas. One idea is practical optimism, this idea that we can find manageable problems. We can address them with clear solutions, and we can iterate. We can try something, and if it doesn't quite work, we don't throw it out the window. We iterate on it until we find something that works. And then the other side of the equation that believes, don't bother. It should come as no surprise that I side on the side of practical optimism, that we can make a difference in a number of very manageable problems. And I want to tell you about the one that I chose during my service. When I arrived in my village of Bandafassi in southeastern Senegal, malaria was a huge problem. Children were dying. Children under 5 were dying, and they still are. And I was a small enterprise development volunteer, so I wondered, I'm here for business. What can I do about this malaria problem? That's not my domain. But I realized, or came to realize, that all that the health system needs are business processes. Let's unpack that. What's the problem? We've got diagnostics. They're great. They're super sensitive. They will tell you within 10 minutes whether someone has malaria or not. We have drugs. They're awesome. You get that person the drug in time, they will not die. And we have trained clinicians like Elhaj Baji, who are totally capable of delivering these services. So what's the block? Well, it's supply chain. If those tests and drugs sit in the national warehouse, they're not doing any good. And it's the same process, whether you're supplying drugs and tests or whether you're supplying iPods. It's a business process, managing stock. Elhaj can do amazing things, but if the clinic isn't staffed sufficiently, they won't make a difference. That's human resources. That's a basic business process. So, yay, I've got something to give. And I spent my service working on bed net distribution logistics. How do you get life-saving, insecticide-treated bed nets to the people who desperately need them? We started out delivering about 1,000 bed nets, and we came up with the question, how do you choose who gets them? Now, up till then, the conventional wisdom was that doing a household census was prohibitively difficult. There's no way you're going to get community health workers to accurately take a census and figure out who really needs the nets. That's bullshit. They absolutely can do this. Why underestimate? So I spent the next year going from 1,000 nets to 5,000 nets with partners, with my counterparts. The next year, it was 20,000 nets. And the year after that, I spent a lot of time in the Peace Corps. The year after that, the national government picked up the methodology that we had piloted and to date has delivered millions of nets across that country using the methodology that we piloted. Great, the nets are out there. How do we get people to use them? Again, community health workers can do this. This is something they can do with the right training, is educate people how and when to use their bed nets and how to maintain them. And we can train them. This is something volunteers are uniquely situated to do. And so we took that idea of taking some practical optimism, and I went back to Peace Corps headquarters after my service and with some of my colleagues presented to our senior staff the idea that maybe we can take this on the road, that we can do a focused initiative in all of Africa to combat malaria. And that became the Stomping Out Malaria in Africa initiative. What do? We bring volunteers from all over the continent to Senegal for a 2-week boot camp training. This is state of the art. We have a distance learning center where we'll bring in experts over Skype from key partner organizations. Here you have Jim Harrington, who's also an RPCV. He's now with the NIH, and he joins us to train volunteers on how to do malaria prevention. We have presenters from Tulane and Emory and the CDC. We get great folks to help us with this training. And then we keep in contact with this group that has been trained at the boot camp over Facebook. We use Google Drive to do monthly town hall meetings. We use Skype. We're trying to use technology in a smart way. And the question is, does it work? Yep. This is the difference between 2012 and 2013. It's the number of activities that volunteers in the field did in malaria prevention. We didn't add new volunteers to the field. We just trained a small core and then asked them to go back to their countries and get the rest of the volunteers involved, and they did. In 2013, we reached over 450,000 people with malaria prevention messaging. But I want to talk to you briefly about one key project. It's called Pecadome Plus. Pecadome is a French acronym that stands for home-based care, and the plus is what's important. In the existing Pecadome model, you have community health workers in the community trained to do tests and treatment. But they have to wait for someone to come to them and ask for that test, ask for that treatment. Even though it's available in the community, many people were not seeking care. So we came up with a very practical, optimistic solution. We said, what if, instead of waiting for them to come to us, we do a weekly sweep of the village? We go door to door. We knock on the compound door, we stick our head in, hey, anybody got a fever? If they do, they test and treat right on site. And the results were astonishing. In this one village, you saw a significant reduction in malaria. But one village isn't enough. And so the very next year, after the volunteer who ran the pilot left, we had a scale up. A new volunteer came in, did a controlled trial in 30 villages, 15 intervention, 15 control, and here's what she found. At the beginning of the intervention, the numbers are the same. By the middle of the rainy season, it's about a 3x difference. Towards the end of the rainy season, it's a 16x difference. We're blocking onward transmission. So we've got this great idea. Let's take it on the road. And we're this year going from country to country, trying to add additional pilots on this program, which we think we will. I'm going to jump quickly to a couple of lessons learned before the end. Firstly, it's easier to work hard when it's personal. You can tell I'm fired up about this, right? The reason I'm fired up is I've seen people die. And it's not a statistic. They're people that I know. And you can use that and turn it into a powerful force for good. Optimism doesn't mean that you paper over the failures. You're going to get out there. You're going to fail. It will happen over and over again. Optimism means that when you fail, you get back up and you do it again. When we try to figure out how to do something, it's not enough to have the strategy. You need the tactics, and that always means local. And this is something volunteers know incredibly well. And lastly, I see this all the time in development, and it drives me crazy. A great idea, they tried it once, there was something wrong, some little tactic that was not quite right, and they threw out the strategy. And we can't do that. We need to learn, we need to iterate, we need to get better every time we try it. So, in conclusion, this is Sergeant Shriver. He was asked, what should Peace Corps do? And he put together a think tank, and they worked late into the night, and they came up with a memo and sent it to Kennedy. And at the bottom of that memo, it said, if you decide to go ahead on these, the Peace Corps can be in business Monday morning. That sort of urgency, that sense that we can accomplish great things in the short term, we need to bring it back, and we are bringing it back, and you can be part of that. We need you to join the Peace Corps. How many people are interested in joining the Peace Corps? I'm going to say this as clearly as I can. You can change the world. You can make an incredible difference in the world around you if you do this. Please do. Thank you.